everyone. Thank you for joining us. Tonight's Talk with Impact is about physical therapy, and we have been lucky enough to have Janice Lee come and join us this evening, and she's going to walk us through all different facets of physical therapy. Janice is a licensed physical therapist assistant, and she's going to tell us a little bit about her role and how it differs from a physical therapist. She's actually going to give us the inside scoop on navigating insurance. And she's going to talk a little bit about how to use physical therapy in all different aspects of your life at all different times of your life. And so, Janice, thank you for joining us. We really appreciate you giving up your evening to chat with us.
Thank you for having me.
Sure. So Janice, as I mentioned, you are a licensed physical therapist assistant. So can you tell us a little bit about what a licensed assistant does and what the difference is between you and a physical therapist?
Okay, yeah, sure. So the physical therapist nowadays, and this has started around the year 2000, is most of those graduates coming out of school obtain a doctorate. Means that they're clinically an expertise in that field. So they do a 4-year undergrad, which usually is heavily loaded in the science field. And then they apply for PT school. They do 3 years in PT school and they come out with a degree, a doctorate degree in physical therapy. Before that, of course, eventually, way back when, before the 80s, most of the schools were just, you did a 2-year undergrad and then 2 years of physical therapy. Then they went to a master's program, which was 2 years undergrad, 3 years of PT school, and now it's become a doctorate program. So the difference is I'm a licensed physical therapist assistant. So my degree is basically just an associate's degree. My program was 2 years long. I say 2 years long. There are requirements that you have to have. And this is where it got stickler to me because I took a break from school. My original degree was as a recreational therapist. So I was working as that and I decided to go back to school. Unbeknownst to me is a lot of my credits in the science and math field did not transfer. So I had to go back to school and retake some classes like physics and anatomy and physiology, which are all classes I had beforehand. So the PTA program is not one that you can come out of high school and go to community college and get it. You have to come out and acquire so many, your basics, English, psych, all of that, and then you're accepted into the program. So it is a specialized program. As a licensed PTA, we're just like a PT in that we graduate, we have to take a state licensure test and pass in order to obtain your license. And we have to keep our license current on a rotation of every 2 years, which requires, a continuing education program. We have to have so many hours of different types of education. And we have to work X amount of hours in that 2-year span in order to qualify to get your license renewed.
Oh, okay.
So, yeah. So if you retire, you don't work, you can go on an active status, but eventually you're going to lose your license. And that's okay. I mean,
and then you'd have to start all over again. Is that it?
A lot of it, yes, you would. Yes. Yeah.
Okay.
Okay. So in the clinical setting, hospital setting, the licensed physical therapist practices under the plan of care by the physical therapist. So ultimately, I'm working under the PT's license, not only mine, but theirs too.
I see.
Yes.
So the physical therapist would maybe have a consult with the patient and decide kind of what therapies are needed and make out a plan of action. And then you would actually walk them through that plan. Is that it?
Correct.
Okay.
Physical therapy is sort of the extension of your doctor. And of course, there's multiple healthcare available in different areas to, help with that extension from the doctor. But yes, mainly a patient comes to our clinic, they're usually referred to us by a physician, and they come with a prescription in hand. However, in the state of Virginia, and this is not true in every state, we have what we call as a direct access, which means that a patient, if they really want to come see a physical therapist without, consulting the doctor first, we would actually see them. After that, we would eventually get the doctor involved, because the doctor really oversees everything as far as medical concerns with their doctors, with their patients.
Okay. So if someone said, geez, I have a little bit of a shoulder ache, I want to just skip my primary. I know he's just going to send me to physical therapy. Right. They could, in all actuality, walk into your office, but then you would circle back around with their primary care. Okay.
Exactly. Okay. So to get back to the original question is, yes, a patient would come in, the physical therapist would do an extensive, what we call an evaluation, where we would take the patient's history, ask and learn how their injury mechanism might have happened, what medicines they're on, all sorts of things. And it doesn't stop there. Every time a patient comes in, we're always asking questions and seeing how things work. And, is this what bothers you the most? And so on. So it's a forever evaluation treatment going on throughout the whole process. But yes, the PT will do the evaluation. And then me as a PTA, we would co-treat that patient. So there'll be sometimes they come in, they see me, just me. And then there's sometimes they come in and they see the therapist. And by law, the therapist has to do a reevaluation on that patient every 30 days. So not me, but, they have to, the PT have to. Yeah.
And let me ask you this. I don't know. I know you said it's a doctorate program to be a physical therapist. Does that mean that a physical therapist can prescribe medications?
No.
The actual primary care provider has to.
They're the medical doctors. A doctorate of PT is not a medical doctor. They are, for example, my daughter is in Georgia doing her PhD. So yes, she can have the name Dr. Lee once she's finished and completed. But her expertise is in the research aspect. Okay. Whereas in the PT realm, they're more of the clinical experts. So they've studied, differential diagnosing and what works for therapy and what doesn't, what's allowed, what's not, the laws, all of that. Does that make sense?
Absolutely. Absolutely. So now, of course, being in the medical field, we have to talk about insurance. And I actually work for an insurance company, and I'm still confused about how insurance works. So tell us a little bit about how to navigate the insurance. Now, let's say I'm a patient and I've gone to my primary care provider and they've said, oh, absolutely, you need to go to PT. Does my insurance cover that? How do I know if my insurance covers that? How do I figure that all out?
So with most of your commercial insurance, they do have coverage for physical therapy. Now, there are some insurance, like when you get to the senior level and you're in the Medicare, there are a lot of, there can be a lot of guidelines that you have to buy into for your insurance that really, they don't necessarily cover the cost of physical therapy. So a lot of times you'll find those people either A, have to pay out of pocket, or B, they pay a very expensive copay. So as we get older, that's one thing that I suggest to people, is to always make sure that they look at their insurance coverage and see what they provide for you as far as physical therapy, other services like chiropractor, things like that. But if you get a prescription from your doctor, first thing is you should call your local physical therapist, wherever you want to go. Ask them, do you take my insurance? And what is my copay? That's the first step you should do. The second one is, for some of y'all that have the higher insurance, when you go in, don't hesitate to ask them, is there a way you have any financial assistance, or can I pay this on a fee base? just, to see if you can cut the costs out
And
of.
and now with COVID, I understand there's a lot of financing programs available to help people who have possibly lost their job
Right,
or had
right.
to cut down hours. So it never hurts to ask.
No, always ask. You never know. A lot of companies, and the healthcare, I mean, a lot of the businesses are hurting. So, they want you to come in, they want your business. So
Sure.
a lot of them will work with you as far as your coverage.
Sure. And it's funny, I was talking to a younger girl, 'cause, I'm young, but I do work with some people who are younger. She's in her early 20s,
Right.
just out on her own. And she had a rather large medical bill. She had an accident and had to go to the hospital and everything. And she had just received a bill from the emergency room, and it was a pretty good lump sum. And she's like, I can't stroke a check for this. And I said, just call them and set up a payment
Right.
plan. And she was completely unaware that they would set up a payment plan, just because they're young, they don't know or whatever. So I said, oh yeah, reach out to them. You actually can figure out
Mhm.
terms that will work for you.
And sometimes they will offer it. Well, if you go ahead and pay us X amount now, then we'll forgive the rest. It'll be over and done.
Okay.
Yes. So when you call, ask them, well, what can I pay you today to get rid of this? And
Right.
a lot of them will tell you, they'll give you a good rate at it, a good cost
And
cut.
I want to circle back and talk a little bit about how you said, when you're older, is it Medicaid, Medicare,
Medicare
Medicare.
for the indigents.
So it's funny that you should say, make sure that you have chiropractic services and physical therapy services, because typically, before you and I chatted earlier this week, I always thought physical therapy was for, athletes or younger people who maybe gotten an injury. I never thought about, older people needing it.
Right.
I know rehab from hip replacement or things
Right.
like that. But in general, you always think of that younger person going to physical therapy. But there are a lot of reasons that an older generation person would go to physical therapy.
Correct. And like you said, the joint replacements as we get older, we have the arthritis, osteoarthritis complications that occur. So you see the knee, the hip, shoulder replacements, that type. But also as we age, we begin to lose a lot of our balance, our vestibular system. And that can be from eyesight, hearing, sensation on your feet from diabetes, or peripheral disease in the legs and the feet, and we just don't have that sensation. So we can work towards vestibular exercises, or what we would call balance exercises, that we can teach you to help with your balance and hopefully prevent you from falling.
Oh, that's great, because as we know, the older you get, the incidents of falling are
Correct.
really what contribute to deteriorating health.
Right.
Yeah.
So that's one thing. Another thing as we get older, and for women, we've been through those childbearing years and we're postmenopausal. So one of the bigger trends now in the physical therapy is the women's health end, where we have therapists that specialize in incontinence. They
And
do
physical
also
therapy can help that.
Yes.
No kidding. Okay.
Yes. And it's it's a one-on-one. It's very private, because you do get a little intimate there. But also I wanted to say that they do have men's health for incontinence too, because there are men that do have incontinence issues also.
Sure.
So what you'll find is most of the male PTs will do the male incontinence, and females will do the female incontinence. Yes.
That's great.
Yes.
So again, that's after your childbearing years that kicks in for you. Are there other things besides the balance issues and the joint replacements and that type of thing that women say over 40? Are there things that we should be looking out for that maybe physical therapy can help with?
Yes. Another thing, postmenopausal women, we have an increase of having the osteoporosis. The therapist is great for education in this. They'll talk to you about, physiologically what's going on, the do's and don'ts. Yes, you need to exercise, but and weight-bearing activities and strengthening activities are so important as we get older also to maintain the vitality of our bones. So they're a great resource for education and also for exercise programs that, will keep you going. I can't always say fit. I mean, because we're not always 100% fit,
Sure.
but to get you to the level you need to be at to maintain.
Great. And so we've talked about a little bit about when you're older, but let's go now to when you are active and you have, say, a sports injury, or had a little too much drink and you fell down the stairs and hurt your knee. How do you know? Well, in that case, let's say I did fall down the stairs. How do I know if it's just a lingering pain and I just need to, give it a couple days, put some ice on it, take some ibuprofen, or I better go in? I mean, what are the telltale signs where I should really get this looked at?
Usually within the first 2 to 3 days. Every injury goes through a process of, it's the inflamed phase where it's just irritated. It's because you injured it. And that's going to be with the first 24 to 48 hours. And then after that, your body responds differently. But if you're still having that pain, and everybody is different with their pain level because everybody perceives pain totally differently. For you, Kathy, a 10 out of 10 might just be a 4 out of 10 for me.
I'm going to go with that because I am a sissy. Yeah.
So I would say yes, after 3 or 4 days, if you're still having that 10 out of 10 and it's preventing you from functionally doing your activities of daily living, you probably need to seek some medical advice out. Yes.
All right. And okay. I just had a good question too in our chat. So, and I am the biggest offender of this. Physical therapy can sometimes not be so fun. It can really hurt. And so a lot of people are like, I'm not going to go do that. What would you say to them? How would you kind of combat that argument and say, no, you really should?
We're known for PT, the physical terrorists, but we're really not. We're really not. We're very compassionate. We get you in there. We know you're going to be in a lot of pain. I'm going to become your best buddy. You can cry on my shoulder if you need to, but we're going to get through this and you're going to do it. And we're going to reach your goal to where you want to be. So, we push a lot.
Suck it up.
We lay awake at night in bed and think, okay, what can I do with John Doe? What is something I can do with him? And they're always like, why do you think this thing's up? But it's for your best interest. Yes. Yes.
I know my husband had knee replacement surgery a couple of years ago, and the physical therapist came right to the house. It was wonderful. But I remember those first few days after surgery, and he was like bending his knee. And I thought, we're paying this man to torture my husband. Oh my God, he's in so much pain. And my husband has a huge pain tolerance. And I remember the physical therapist just say, when you're walking through hell, you just got to keep going to get to the other side. And he was right. I mean, after it got better as it went. So.
Right. And our body as a whole, we are designed to move. And if we, don't move, then we have more pain, become less mobile, and it's just escalating, roll
sort
down.
Of if you don't use it, you lose it.
You lose it. Exactly. Yeah. Exactly.
So now let's talk about sports injuries. I mean, you have kids, I have kids, we all of us here, and God knows that the physical therapists in the Richmond area have gone on vacation thanks to my family. Carted off the lacrosse field, carted off the football field. Right. So about sports injuries, is there, those usually come, you see your doctor obviously, and they come to you. Do they come with an attached time zone? Like, okay, this person has pulled ligaments in their knee, that's going to be 30 days of physical therapy. This person has, pulled hamstring, that's going to be 45 days. Is there a set amount of days?
No, and I always say if I could look at my crystal ball and answer that question, I'd be a millionaire. Simply because the fact, physiologically, yes, the body heals like you and I. When we break a bone, physiologically, it has certain steps it's going to go through.
Sure.
And it eventually will heal itself. However, but each human is different. We perceive pain differently. Our culture is different. So what might take someone 2 weeks might take someone else 6 weeks. So
it's all by ear and personal development, basically.
Yeah. Yes.
Wow.
Yes.
Wow. That's great. So for sports injuries, is there, a core group of exercises you always start out with? Like we always do stretching, or we always do this first before we go into some in-depth kind of exercises for them? Or is it, again, very individualized?
Most injuries, there is certain protocols that we follow, that we go by, that are proven steps that we should do. And then you expand on that as far as customizing someone's rehab, their exercise program for them. That's why therapists are very important. So are the athletic trainers in the realm of high school sports.
Right.
Middle school, they don't have so much the accessibility to athletic trainers. Whereas, in Chesterfield County with high school sports, they all have an athletic trainer that is.
Right.
Most of those athletic trainers come from usually a physical therapy clinic where they are utilized. Say, for instance, in Chesterfield County, a doctor is assigned to a specific school. And usually under that, there's a physical therapist with him. And then under that is an athletic trainer. The athletic trainer is there to address any concerns that happen right then and there. And then they also address any concerns as far as the rehab.
Right.
You might find, though, that they need to come to physical therapy because it might be an injury that's a little bit more difficult to facilitate or treat than, say, in a high school locker room.
Got you. I got you. I don't want to be in high school locker room. I don't want to go in there.
Right.
So, Kitty in our chat brings up a good point. Sort of the stronger and in better shape you are, probably the quicker you're going to respond to physical therapy. Is that accurate?
Definitely.
Right.
Oh, yeah. Because physical therapy, your mobility is, run by your joints, your muscles, your ligaments and tendons. The stronger they are, the more mobile you're going to be. So if you go in, and I always tell patients that know that they're going to have a knee replacement, come on in, I'm going to show you things to do. We need to get this muscle strong and this muscle strong.
Right.
Before you actually go have the procedure done, because then you're going to be one step ahead.
Right.
So yes, fitness is very important for the athletes to rebound from injuries. And also as we get older, when we know we're going to have surgery or a replacement, we need to be ready for it in all aspects.
And to that end, are there, do you talk to your patients maybe about their diet or some supplements that they should be taking to keep their joints and bones and muscles in working order?
Right. We really don't talk about supplements. We leave that more for the medical doctor.
Okay.
But yes, we do. A lot of times we'll talk diet. What would be good, people that maybe that come in that have high blood pressure. We talk to them about, their salt intake, that type of thing, or people that are diabetic, how important it is before they come to therapy or throughout the day that they're, monitoring their blood glucose levels, what to eat, what not to eat. But yes, we do incorporate a lot of that, nutrition. Yes.
Right.
Mm-hmm.
So I'm well past my athletic days now, but I am in that 40 plus age group. And so are there things that I can do to sort of, I mean, I try and walk every day, and really that's a mental health thing. I'm not even thinking about keeping in shape, but I know the use it or lose it, mantra. So I try and get out and walk every day. I'm now starting to look into all different programs for women my age or older to sort of prevent anything from happening, or just kind of stave off some of those problems that I'm seeing, like my mom having, things like that. So are there some of your personal favorites, like yoga or any of those types of exercises that you really recommend to the over 40 group?
Right. Let me circle back real quick too.
Okay, sure.
And that was a good point you said about your mother. And I tell people this, especially ones that come in and they're having a hard time with their arthritis, their posture, they're sort of bent over, they're leaning forward. Usually what your mother was at that age, your age at her age, is usually what you're going to be. So yes, it's very important that if you see your mother and grandmother had, a lot of arthritis or a lot of back issues, more than likely you're going to be that way too. So we can gear exercises for you to start to, it's not going to prevent you because genetically you're probably going to end up that way, but we'll teach you muscles that you should be, strengthening, posture awareness, so that it's not a snowball effect all at once. The complications don't come all at once. We get you ready to hopefully deal with those mechanic deficits that occur with it.
Right.
So, but
oh, go ahead. I'm sorry.
No, you go ahead.
And so I hear a lot about how great yoga is for hitting you top to bottom and hitting everything. And also about those weight bearing exercises, how important that is, especially if you've hit menopause. So are those things that you recommend?
As in any exercise program, we recommend anything that's cross training. So if you're a runner, don't just run, because when you run, we talk about different planes in the human body. So if you're a runner, you're constantly running in that singular plane. So you're working those hip flexors, those glute muscles, your upper body to keep your posture up. But you forget about all those muscles that are on the inside of the legs and the outside of the leg. It's not to say they're not working, they are, but they become sort of form a habit. They're used to doing that. So it's very important to do some cross training, other activities that would involve like things that you do side to side or twisting, that type of thing. Okay, so yes, it's important to have a good cross training regimen. So yoga is very good. Running, walking, weightlifting, and when I say weightlifting, I mean women at our age, 50 plus, 2-3 pounds at the most. That's all you need. It's repetition. We're not in to build the muscle mass, but to keep ourselves fit.
Gotcha.
Okay.
So I'm curious, is there one area of physical therapy that really is your passion? I mean, do you like working with the young athletes? Do you prefer working with the older women? Or are there other aspects of physical therapy I'm not aware of that maybe you are particularly interested in?
No, I would say that my passion is in any type of joint replacement. And I love manual therapy, which means it's not massage technique, but soft tissue mobilization. I do love the hands-on type techniques that you can use for pain management, to help muscles relax, to get joints moving more freely, that type of thing.
So that just brought me to another question. Now you say that those are manual techniques. So can you tell me a little bit about the equipment a physical therapist does?
Sure. So we have a lot of things that are available to our use. We use electrical stimulation, ultrasound, and all of these for pain management, because a lot of times when you come into our office, you're in pain. So our first goal is to get that pain under control, because 9 times out of 10, you're not going to do anything that we're going to ask you to do because you're in pain. That's where your mind is set. So we have different modalities that we can use to control the pain. And that's, most of it. We do have some things that, well, we have a lot of exercise equipment also that we use for exercises, but that's
heat and ice, I assume.
Yeah, that's all falls under the modalities: heat, ice, e-stim, ultrasound, paraffin baths, whirlpool. Some of the older things that we used to do. We don't do them that much anymore, but yes.
That's awesome. That's awesome. I just had a question, and I know what it was. Typically, if I come into your office for a consultation and then it is decided that I do need physical therapy, how long are physical therapy sessions? Are they 15 minutes, an hour, or does it vary?
It varies, but typically we do have schedules, but typically you're going to spend time with your therapist, let's hope, and make sure when you go into a PT clinic that all your time is not spent with the physical therapist, physical PT technician that you are seeing with the therapist. But you will probably do a one-on-one with your therapist for about 30 minutes. And then you might be handed off to the technician who might go through your exercises with you or whatever, the PT or the PTA wants that technician to do with you. So yes, 30 to 45 minutes is a typical time frame, and usually 2 times a week, sometimes 3 times a week.
And then I know just from my kids' different injuries, they send you home with exercises to do on the days that you're not in the office.
Yeah, and we talked to you at the beginning about your accountability and this process of getting yourself maybe not 100%, but to a point where you can go back to what you were doing beforehand. Yes.
Right. Right. I had one more question about after you see, I know that most providers now just have connections all over the world. So if I were to go into my provider,
right.
Well, here's a list of physical therapists we use. Right. But let's say I'm on a small insurance plan and they don't cover that particular therapist. How do I go about finding a therapist that I know I can just call my agency and find out who they cover, but let's say I didn't have that resource or whatever. Is there an association that all physical therapists have to join, or is there a review of all physical therapists where I can look and and choose my own?
Right. And that's a good point. I want to say this, most people don't realize it, but you have a choice to go anywhere you want for physical therapy, and don't let a doctor tell you otherwise. And yes, I would ask around your friends that have had physical therapy. I would visit some of your PT locations if they're in your area. Call them and ask them if they accept your insurance. Go visit, talk to them, face to face. Do you think you can really get along with this person? Because they're gonna, be giving you a lot of pain.
And plus you're going to be spending time with them.
Right.
I mean,
and believe me, you're not inconveniencing them if you walk into a clinic. We're more than happy to, have a face-to-face with you and tell you what we offer. And I don't know about you, it's like my doctor, I have to have a rapport with someone like that. And especially with the PT, because you're going to be spending a lot of time with them, and they're going to become an intimate part of you because they're going to know all your little secrets.
Right. So, which is for your benefit, but you're right. They do need to know what they're sort of dealing with, all aspects, all kind of risk factors that they need. So you do need to
ask earlier, are you going to see me face to face, or am I going to be the person sitting in the chair with your technician and just doing exercises?
Right.
Or are you actually going to spend time with me?
Right. And know my case.
Right.
And be able to recognize changes and improvement. That's important. Right.
Yeah. Yes.
So I have a great question here in the chat, and I'm glad they raised it because I didn't realize this. going back to talking about modalities, when you
Sure.
add different modalities to your physical therapy plan, each modality is an additional cost. Is that right?
No, not necessarily. We do not. How it reads is if any layperson, if they can do that to themselves at home, we do not charge for it. So when you get heat or ice, that is a no charge. Ultrasound is one of those that insurance companies really don't look at it that much. I don't think we're going to reimburse you. But ultrasound is a very, small part of it. We only take minutes with it. So that's usually a no charge. The electrical stimulation, the dry needling, yes, that is a billable charge that we do charge you for.
I see. So let's say someone comes in and their insurance isn't that great, and you really feel like that dry needling
Right.
is something vital that they would benefit them. What do you say to them? Or is there a way you can circle back to their insurance company and sort of sell the insurance company out?
That's it. We have ways of how to bill it, that the insurance companies, we're not doing it illegally by any means, but we do have ways to bill it that the insurance company will cover it. Yes.
So if you need it, you
Right.
should absolutely get it, and
Right.
then we'll figure something out with the insurance.
Right. Exactly. Yes. Okay.
Wow. Wow. Let's see. I have another question here. From Kitty. And yes, this is in today's news. Speaking of the need for extensive physical therapy, just before I came on tonight, they were saying that Tiger Woods was in that terrible car accident this morning, and he was at that moment in surgery for extensive leg surgery. So yes, sending out positive vibes to Tiger.
Wow.
And then Kitty wants to know, are the things being used for healing professional athletes on the way to being more mainstream, like the chambers that some of them use for sleep? What's that cold chamber that they go into? I've seen that really on the rise lately.
Unfortunately, we peons are not paid millions of dollars, so
Right.
we don't get that. Professional athletes are totally different. They're pretty much given whatever they want 24/7. They are exposed to technologies that are not available through our insurance companies. So yes, those athletes are treated with, not just PTs, but it's a whole slew of people. And you have to stop and think, yes, they are $1 million investments for a lot of companies. So they are going to get the royal treatment, and it doesn't matter how much it costs because they can afford it.
Right. So I don't think we're going to see the mainstream anytime soon.
Personally, but we as therapists, we do our best, and just understand we're very compassionate, and we want you to succeed and overcome.
Sure.
So.
And you do have a buffet of options to help the average person. I mean, I'm not, getting beat up in the Super Bowl every day. So some modalities that would be appropriate for that wouldn't be appropriate for me anyways. I had a question. I see all of these new places, these salt baths that are popping up, and you go in a salt, water, and it's a closed pod, and it's supposed to be great for your stress and everything. But one of the things they do sell that on is that it's supposed to be great for your body too. Take out the joints, things like that. So what's your opinion on those?
Sure. So I'm going to reach back to my aquatics experience, which I did for many years. The thing with salt is that with salt baths is the concentration of salt. So you actually get in and you float. So it takes away the gravity pull on you, and you have more of the buoyancy. When you get into a pool and you're in deep water, you float. Well, it's the same concept. However, with salt baths, it doesn't take nearly as much water because the salt content gives that water a different specific gravity. So you float. So with no gravitational pull on your joints, your muscles, your joints, they relax. So it makes you feel good. It's a great way when you have arthritis to do something like that.
That's great. And I remember when I was pregnant too, I remember thinking, oh my God, I just need to go somewhere and feel weightless just for a little while. And
Right.
I went and floated in the pool like the
Right.
big beluga whale I was, and it did
Right.
really help. So yeah.
And in the PT realm, we do pool therapy. There are some businesses that do have pools that they really do, they utilize for pool therapy.
Right.
So,
Right. All right. Well, I have another question if you have time. Jen Stibe says it seems that PT is almost required now before other options like injections or surgery and sometimes even medication. And so, do you find that this is usually the best option to avoid the surgery altogether? And is it, effective for
oh, yeah,
obviously?
yes, yeah.
Therapy,
And I have to agree
but
with her. A lot of it is, you come to therapy, let's see what we can do to maybe avoid the surgery, because no one wants to go into surgery. Surgery is not a guarantee.
right,
And you have a percentage of those that will do well, and then those percentage that you might suffer from all the complications that the list they give you. So you don't
sure.
know when you go in which side you're going to fall on. Sometimes, hopefully, the odds are in your favor. But yes, and understand when they come to us and they have all these complications, we're, as a therapist, we are forever, like I said, reevaluating. There's some things that we just can't really address, and we might suggest to the patient and the doctor, why don't you go try a chiropractor for a little bit?
Okay.
Something's going on with this joint, and we don't do the high velocity mobilizations. The chiropractors do. Let's send you over there and let's see if they can do something for you.
Right.
Or have you tried acupuncture? That might be something that you can look into doing. But yes, we will try to educate and try to come up with as many things possible to avoid that surgery.
Right. So the least intrusive. Let's
Right.
start there and then
Right.
go forward.
Because it's a lot to recover from a surgery.
Absolutely.
And your odds too.
Absolutely. Absolutely.
Yeah.
Jen has another question. She wants to know your thoughts on ice baths for athletes. And I have heard tons of stuff about ice is really great for inflammation, and athletes are at a higher standard for inflammation. So what do you think? Are ice baths effective?
That might be a question for my daughter to answer because she's the athletic trainer. But ice is very important for the first 24 to 48 hours because your body goes, when you have an injury, it goes into an inflammatory response. Okay. So ice is great. We tried to stay away from the NSAIDs like ibuprofen, Motrin, Advil, because that sort of interferes with your natural inflammation process. So Tylenol's the good thing to take.
Okay.
Ice, first 24, 48 hours. Then after that, you can, and I tell my patients all the time, go between the ice and heat, figure out which feels best for you and which works for you. Sometimes patients like the ice, some patients like the heat, but that's usually after that second or third day. Yeah.
Right.
Okay.
Well, let's say someone is injured and they're about to come to physical therapy. What is the one bit of advice that you would tell them that is the most important thing they should know before they start physical therapy?
We don't bite. You're going to find that patient when they come in, your therapist is probably going to become one of their best friends, and they're going to know a lot about you by the time they're finished.
Right. So just give yourself over to the process.
Right. And it's hard to let go. It is. We do have most therapists, we do have a strong background in a lot of the psychology classes. So we recognize a lot of things, what they might be going through psychologically. And, we have ways of helping them cope with it too. So.
Right. Well, that's awesome because, if you feel terrible, your mindset isn't going to be in the right place. So if you can help them out with the mindset, that physical therapy is just going to be that much more effective.
Exactly.
Yeah. Well, that's great. Well, I don't see any more. Oh, okay. Wait a minute. I lied to you. Karen Buckley says, seems like there was something going around recently that heat was the new ice. So it's still ice for that 24 hours. She wants to be sure.
Yeah.
But
Ice
then
for
after that 24-hour period,
right. The
then you
rice,
do what feels good.
right. The
Right?
rice, rest, ice, compression, elevation for at least the first 24 to 48 hours. Yes.
Right.
Okay.
All right. Well, Janice, I thank you so much for giving your time this evening. I know you're busy, and to give us your time on a weeknight, that is just so great. We really appreciate it. And this
You're
has been so informative. There were a lot of things about physical therapy I didn't even realize, and especially that piece about the insurance and how you can kind of work with them. So we appreciate your insights and your advice.
Sure.
And we just really thank you for your time.
You're welcome. Thank you.
All right.
Janice.
Take care.
Yeah.